Something that always comes up is patients are afraid to take allergy and asthma medications because they're afraid they're going to become addicted to them. The problem is not that they're addicted to the allergy medications, it's that allergy medications treat symptoms. So when someone has an asthma exacerbation, it's not the same as bronchitis or sinusitis or any other infection where you take the antibiotic, the infection resolves, you're feeling well. If you're like high blood pressure, if you don't address what's triggering the allergic response and remove the allergic trigger, go on allergy shots or allergy drops or sublingual immunotherapy, you are always going to need medications. I find it interesting that the asthma guidelines talk about getting a patient under control and then backing off and getting off the medications. If you're not addressing what's behind the root cause of the asthma exacerbation or the ongoing asthma symptoms, you're not going to get better. Your asthma symptoms are going to come back. I remember a patient would come to me who was going to the emergency room and frequently on prednisone. It seemed they did well for 3 or 4 weeks and symptoms came back. And that's because the allergen-induced inflammation kept coming back from the dust mites, from the pet dander, from the molds, the allergens in the environment. People always get confused with nasal sprays. The over-the-counter nasal decongestant sprays, many people think of the brand name Afrin, but it's the chemical oxymetazoline. That is one where it immediately relieves the nasal congestion, and if you use it continuously, you then get rebound congestion, which can get addicting because it's so severe, and they even have a medical term for it called rhinitis medicamentosa. But that's the nasal spray, and that's why the warning says don't use it continuously past 3 days. Nasal steroids like the brand name Flonase, people know it as fluticasone, Nasacort triamcinolone, Nasonex mometasone, or Rhinocort budesonide, those are not addicting. Those have to be used continuously. Saline sprays. So the vehicle is the spray. It's the chemical we're concerned about. But the nasal decongestant sprays and often the oral decongestive medications can have rebound congestion and be more addicting. And they have more side effects.